Before we start, and I'm going to show you some of the statistics about the size of the industry here in LA by comparison to other regions throughout the United States. So we're talking about, how LA fares competitively vis-a-vis the greater New York area or Boston or the Bay Area in terms of the number of people working in the industry. And the source of the information that I'm going to provide is the Basile Bioscience report that is done every 2 years to the Biotechnology Industry Organization. And it was unveiled actually during the Bio meeting in San Diego in June. And the statistics show the size of employment in the industry up to 2012. We're almost 2 years behind, but that's okay. And overall, because of LA's size and fragmentation between here and Orange County and Ventura, when you're driving around, you're not going to see something like the Golden Triangle in San Diego or the Research Triangle in North Carolina. But we have a lot of companies. We have at least 900 companies engaged in some kind of bioscience, research, development, and manufacturing activities. We tend to be more on the medical device side of business than biotech, but the biotech component is growing and it's going to grow faster. And the panel here is an example of the new faces popping up on the screen. You ought to keep an eye on them, particularly Puma, which is making a lot of splash these days in the news. It's a $7 billion company, and the others, of course, are going to follow suit. So give Alan a great deal of credit. Alan Auerbach, a lot of people don't know that the latest prostate cancer drug called Zytiga, which is marketed by Johnson & Johnson, it came out of LA, came out of his work at Cougar Biotech. In 2009, his company got bought by J&J for $900 million. Now Zytiga is a $1.7 billion drug. It is going on being $7 billion drug in 4 or 5 years. I think Johnson & Johnson is laughing all the way to the bank because they cover the cost of the acquisition and they are making money on it. And this is because of one of the companies located here. And Alan, of course, created Puma. Puma is working on a breast cancer drug, and he'll talk about it when the panel starts. But it's an example of the new company that we want to showcase, and we want everybody to know that there is life in the biotech community in LA. So the Basile report looks at the subsegments of the industry, ag, bio, and biochemicals. And LA, of course, is not in the top 5 areas. These are the numbers of employees in these metropolitan statistical areas. These are areas that are economically integrated and defined by the federal government, and it's a useful entity to measure economic activities with. So the Basile report goes to these MSAs and gathers information about the number of companies, employees, activities, compares and contrasts. If you haven't seen the report, it's the only one that can give you a clear picture of how the industry looks like at the regional level. Measuring the industry at the state level is meaningless. States are not economic entities. Measuring it at the county level is meaningless. Counties are not economic entities. You have to have well-integrated economic units to measure the industry performance with. So these are the MSAs that are leading in the ag, bio, and biochemicals. Drugs and pharma were not strong, but we're number 5. And this is just covering LA and Orange County. And if you add Amgen in Ventura, which is not part of the MSA, the LA MSA, the industry size goes way up. Medical devices were number 1 throughout the country. We even have more employees, medical device companies, than all of the state of Minnesota. Number of employees in companies engaged in research, testing, medical laboratories, companies like Response Genetics, a USC spinoff, Siemens Medical Solutions, close to LAX, Beckman were number 3. And then bioscience-related distribution was number 2 after New York. And if you add everything, we are the second largest cluster, again, by MSAs, 81. If you add the Inland Empire, Ventura, and Santa Barbara, we may be number 1. I'm going to be working on that and see if this is going to be the case. So this is just to show you that we have a vibrant community. And although some of our big companies are laying off people, there are a lot of emerging companies that I see every day, interact with every day, that are adding a lot of jobs. And that is the hope, like the companies here on the panel, the hope for growing the industry. With that, I want to introduce our leading sponsor, George Colindres. He'll give some welcome remarks, and then we'll transition to the panel. Thank you. Enjoy yourself.
Okay, I'll
See you in future events. Those who are not members of SoCalBio, you should join. Brandon will be after you.
So Ahmed just basically said everything I was going to say. So I'm George Colindres. I'm a startup lawyer at Perkins Coie, one of the sponsors of SoCalBio. On behalf of SoCalBio, thank you to all of the sponsors, and also thank you to the rest of you who are making this and all our other events a success. SoCalBio plays an integral role in fostering a sense of community and cohesion among the various and widespread players in the biosciences industry here in Southern California. And it does it by sponsoring events like this, events in Irvine, events up and down the Southern California area. I strongly encourage all of you to, if you're not already members, to become members, or even better yet, sponsors, and become part of that work and help Ahmed keep this organization going and fostering this community. With that, I'll hand it over to Tom.
My goal here is to introduce you to the subject and the panel very briefly, because I'm not the main event. I've asked each of the panelists to talk briefly about their companies. During the panel discussion and question and answer, I'm going to ask questions about things that don't relate to the science and technology. You're welcome to do that if you have an interest. But I'm going to ask them questions about how they got funded, how they got started, and other things that will help anyone that's a budding entrepreneur in the audience would like to hear someone else's story, to give them ideas on how things might be done differently. Because a lot of the paradigms for how companies are funded and kept going, and secondary fundings and all that, is changing now. And it's a dynamic environment, and you can learn from their experiences, I'm sure. So the thing that struck me when I was thinking about how to introduce this is that when I started my pharmaceutical career, this is what I was working on.
Prozac.
No, not Prozac itself, but small molecule organic things, that something you can take orally, something you could, there's no protein involved, there's no peptide, there's no antibody, there's no DNA. And what you're going to hear today are 4 companies that are only working in these other spaces now. And the field of medicine has changed and enormous, and a lot of the very exciting things that are coming along in medicine are now part of this new revolution in medicine. And so if you're not aware of this, I'm sure you are, but if you're not, you need to take note of this, because a lot of the high value added products that are coming out, and truly staggering cost per year for taking some of these medicines, also are enabling doctors to do things that were just not possible to imagine before the biotechnology revolution started. So you're going to have an interesting afternoon, and all of you know these things, I think. We're going to talk about antibody therapies of one kind or another, and other kinds of things. But this is just sort of a list. There are already plenty of examples in this area, and people today will talk to you about more examples. Antibody-directed drugs, okay? Cell-based therapies, protein peptide drugs, stem cells, all these things you hear about. Not all of them are going to be covered today, but this is the new medicine. And this will be where a lot of the growth in medicine will come. So I think today, this is our panel. I think Ahmed pointed out to you that we are an innovation area for many things, and we're becoming more so. Today's panel will focus on oncology-related drugs. We have 4 great speakers listed here, and I'll tell you about each one of them.